We've talked about PRP before on this show. If you're not familiar, PRP is platelet-rich plasma. What is PRP? PRP as a wash in the uterine lining is very useful and evidence-based in treating folks who have both recurrent implantation failure and recurrent pregnancy loss. So what it is where we take a tube of your blood and we separate out the portion of your blood that contains your what we call your tissue factors, your growth factors, your healing factors. It's the most healing salve your body can make, is the way I like to describe it. And we're basically able to make it in a little tube of blood. So we take a bunch of tubes of blood and separate out that component, and it ultimately ends up in this sort of little orange looking stuff, which we can then place inside the uterine cavity. It is extremely healing and extremely good for that uterine lining. Also very good for folks who have a difficult time growing their uterine lining, or people who have had scar tissue on the inside of the uterus, which is known as Asherman syndrome. PRP is very useful in that regard. You may also know PRP because it's used to treat joints, sick joints, knees and elbows and shoulders. It can be used, it's used very commonly in aesthetic medicine on the face. It can help you also to regrow hair when placed into the scalp. And it seems like every time I say that, then I kind of always end up turning my head to kind of want to see where I could use a little PRP up there. But sorry, that's just me. Does CNY do that PRP? The answer is yes. It's prepared in our lab using some special tubes. Again, simply we also do PRP to be placed in the ovaries, which is something that's called ovarian rejuvenation, which is considered experimental, but it does seem to make a difference in a lot of people with diminished ovarian reserve or with egg quality issues. So I think the world of PRP.